Food allergy or food intolerance. A food allergy is an adverse immune response to certain kinds of food. These kinds of allergies occur when the body's immune system mistakenly identifies a protein as harmful. A food intolerance is a detrimental reaction, often delayed, to a food, beverage, food additive or compound found in foods that produces symptoms in one or more body organs and systems, but it is not a true food allergy. A food allergy is a reaction to a protein contained in food. Individuals who become allergic to a food product at some point in their life, usually early on, have their immune system mistakenly tagging a particular protein contained in food as harmful, as if it were an invader like bacteria. Antibodies targeting this protein are produced and released in the bloodstream. At this point, a second exposure to this food will trigger these antibodies to release a series of powerful chemicals, most notably histamine, which causes blood vessels to widen and become leaky, leading to redness, swelling, and itching. This reaction happens very fast, often within minutes to 2 hours of exposure, and the severity can vary from one person to the next, or even from one reaction to the next in the same person. The most serious consequence is anaphylactic shock, which is a widespread reaction affecting different organs, most commonly causing difficulty breathing and a severe drop in blood pressure. Anaphylactic shock can be fatal, and without treatment, death can occur within as little as 15 minutes. There still is no treatment for food allergies, and the first line of defense is simply strict avoidance of the allergen. But if a reaction does happen, epinephrine, adrenaline, usually via an auto-injector, is the go-to treatment for anaphylaxis. It works quickly to reverse the symptoms by constricting blood vessels, relaxing airways, and improving blood pressure. When it comes to food intolerances, the most basic difference is that these do not involve the immune system. With a food intolerance, the body is reacting poorly to a food, but not because it sees it as dangerous invaders. Instead, the problem usually lies in how the body digests or metabolizes a certain component of that food. Depending on the type of intolerance, symptoms can vary from bloating, gas, cramping, and diarrhea to headaches, flushing, nausea, or a sensation of discomfort. Compared to allergies, which can cause rapid, sometimes life-threatening symptoms, food intolerances are typically slower to develop, and while they can be very uncomfortable, they're not dangerous in the same way. There's also usually a dose threshold, meaning a small amount might not cause any symptoms, while a larger amount will. This dose threshold can nevertheless vary greatly from one individual to another, as is the case, for example, with lactose intolerance. Let's recap. Food allergy. Reaction to a protein. Immune response. Release of antibodies and histamines. Immediate reaction. Life-threatening. Anaphylactic shock. No cure. Food intolerance. No immune response. Slow onset of symptoms. Not life-threatening but can create great discomfort. Can have very variable grades of severity. Anaphylactic shock. Any or more of the following symptoms may be present. These are often referred to as the ABC symptoms. Airway. Swelling in the throat, tongue, or upper airways. Tightening of the throat, hoarse voice, difficulty swallowing. Breathing. Sudden onset wheezing, breathing difficulty, noisy breathing. Circulation. Dizziness, feeling faint, sudden sleepiness, tiredness, confusion, pale clammy skin, loss of consciousness. Other symptoms that might be present include a red raised rash, known as hives or urticaria, anywhere on the body, a tingling or itchy feeling in the mouth, swelling of lips, face or eyes, stomach pain or vomiting. What to do? Administer epinephrine, adrenaline. Call 999. Lay flat and raise legs. Keep warm.